I'm Dr. Deborah Dupree, and together with Felicia Amenta from the San Diego County Office of Education, Joint Powers Authority, Workers' Compensation Manager, we'll be facilitating today's Q&A around some very interesting topics. Right, Felicia?
Yes, right. It's a pleasure to be with you all.
Great. Well, thank you, Kathy, Charlie, Marianne, Christina, Alejandra. Just so you know, we are recording this so that we are able to send this out to our to you, as well as to our other participants who have registered but perhaps not able to join us after all. Well, very good. Happy March 15th. I know it's a big day for lots of school districts throughout California and many other places too. And so I'm excited to hear, and do ask for you to put your comments in the chat box as far as what's the status of your school or school district right now. And so with that, Felicia, you know, that sort of kicks off our first question to put out there. As schools are reopening and more continuing to phase in students at different grade levels, what are some issues to consider? What's been coming your way? What's been coming my way, particularly from your perspective, since you are with the County Office of Education?
I've been seeing a lot of really interesting questions. I've been seeing a lot of questions resurfacing on the written respiratory protection programs, because as people are getting ready to reopen, they're starting to look at, are there healthcare workers or are there custodial workers or are there other workers that they want to have fit tested for N95 masks? So that's been coming up, and a lot of them are like, well, wait, do we have to provide the masks? And I said, yes. And they said, do we need to send the masks with them when they go to get fit tested? And I said, yes. And if they don't fit, then they have to start over again with a new mask. So a lot of them there's a lot of questions resurfacing about that project. And then there's been a lot of questions about a written vaccination program, and if the EEOC, whether they can require vaccination or not, and whether to get their employees vaccinated or not. I will say that a lot of our members, that's a voluntary process that's going on with FEBA to assist with that. And so that project has been ongoing. So there's been a lot of questions surrounding that and how that affects workers' comp claims, which has been kind of interesting. And then there's been a lot of questions about how that affects the governor's presumptions and some other issues. So yes, it's been really interesting. And obviously there's been lots of questions about pre-placement physical issues because people are being hired, right? As the schools are starting to reopen, some of them are starting to hire again.
Yes, I know. I'd like to go back for a second to the whole N95 and KN95 mask, and because as you know, this just came up for us in the last week or two, and it's just an employee who's been off work because of her pre-existing work-related allergy condition going back a number of years, but which has now become compromised under the COVID circumstances. And the doctor was very prescriptive in the accommodations identified, including starting off with a KN95 mask. And I know that the assistant superintendent and I sort of looked at each other, and it's like, well, last I heard is the N95 masks were being preserved for essential workers, healthcare workers, emergency workers. And there are some positions on the job that have been afforded them, but that requires special training, special fitting. And so what is the KN95, and I knew what it was, but I said, let me do some research. And so I think just for our listeners' purposes, and I'm going to turn to you to ask, what is the county's policy on that now? Is that the N95 is something that's approved here in the United States by NIOSH, National Industry Occupational Safety, whatever that last H is, Safety and Health. And so it's an approved device here that meets all of the United States regulations. The KN95 is the mask, similar in features, made in China, that meets China's specifications and regulations, but that doesn't mean it meets our regulations. And so I did a lot of research towards the end of last week as far as when can a KN95 mask be used? And so it is protective. It is more so than a regular mask. And yet it also depends on where it's being applied. Because again, for health workers, it would not be an appropriate utilization. And also for some conditions, because it doesn't filter out particles the same
Right.
way an N95. So not to say it's not ineffective, but its application has to be looked at very carefully. And so I'm going to turn it back to you as far as what's the county's policy as far as the N95, and is it the KN95 even something permissible?
So each district has to come up with their own written respiratory protection plan. It falls under the IIPP. And we've got, through our loss control reps, we have some samples that some other districts have done so you don't have to reinvent the wheel. N95 masks are what is the medical questionnaire qualitative fit testing is being done at the JPA. For our members, we have contracted with all of our occupational health clinics are doing the medical questionnaire, which is required, and the N95 fit testing. Some of our clinics are doing qualitative and some are doing quantitative. That's just a difference in the methodology that's used to do the fit testing. We do recommend that whatever your written protection plan has in it. Some of our members are only fit testing and providing N95 masks for healthcare workers or nurses and health aides. Some are also including custodial in that. That varies from member to member. So we don't have a policy per se. We're just providing the services for the members who develop their own policies because that's unique. And then some districts are not having anyone prescribed to wear an N95 mask. If it's in your written protection policy, then you're providing them, you're storing them, you're keeping them, you're maintaining them, and you're keeping the records. So someone needs to be the N95 czar and own that, you know, because there's responsibilities in that. And to your point, if there was just one employee that needed an N95 mask as an accommodation for a workers' comp injury or a non-industrial injury, those pieces would still be in play because the employer, you know, if they're going to be responsible for providing it and the responsibilities for it, they would still be doing that. But our loss control can help. They can help with the school district's written plan. I can help with the pricing. Obviously, if it's a new employee, it would be paid for by the JPA under the pre-employment physical pricing. If it is an existing employee, all of our contracted clinics have agreed to extend our member rates out to our members to do the fit testing. We do recommend that you take several sizes with you. That way you don't have to go back again. If you're not sure, you know, whether you're a small or a medium or you're a large, take a few with you so that the fit testing doesn't have to end and you don't have to come back again with a new mask.
Okay, I have a couple of questions for you then. You know, first of all, what is the typical pricing for an N95 mask?
So the pricing isn't for the masks themselves. That's something that the members procure. The pricing is for the medical questionnaires and for the fit testing, and it varies depending on the clinic. So I've got 4 or 5 different pricings. So when people reach out to me, I can provide all that information.
Okay, great. And I'll just let our listeners and viewers know that, like in my situation that I just was citing, is that because it was a work-related thing that we're coordinating between the district and workers' comp, the claims examiner is taking place. And basically I mapped out the steps because the school district had never dealt with it. And so I helped map out the steps and guide them on the process so it could be handled efficiently. Because until she has the mask, she's not able to return to work. And to complicate things, she's not eligible. Well, let me restate that. Medically, she is not able to take the vaccination because her allergy extends to one of the agents in the vaccination. Right. And so that complicates the whole return to work effort. And so that's where, you know, if we want her back to work, then the mask is really critical. Now, right. The doctor did raise some other questions as far as social distancing and some other elements that have been put into place. And so obviously with the mask situation, the social distancing becomes less important, but still, you know, for modeling purposes and things like that, it's still a critical feature to keep in place.
I did want to add too, Deborah, that if the doctor has indicated on a workers' comp claim that that is part of the medical equipment that they need to return to work, that can be paid for on the claim, the mask itself too. So that situation is unique a little bit. So that does, the payment does exist to pay for it on the claim.
Okay, great. And so, as we, see the vaccinations roll out, 1 in 5 over the weekend of Americans have been now vaccinated, and millions more expected in this next week. I know I'm excited. My second vaccination is coming today. It's been postponed twice.
Oh, congratulations.
So, yeah, so I'm one of the many being vaccinated this week. But there's a lot of questions that have come up, and you and I both know that EEOC and other, regulatory agencies have continued to update their guidance and policies, and the intertwining of this whole COVID thing with ADA and FEHA purposes continues to get closer and closer,
Mhm.
and then therefore, because of the overlapping conditions, shall we say, between the three, that the emphasis I'm seeing even more is do an interactive process to keep yourself safe in terms of compliance, but also making sure that you are really exploring all options with the employee, because we have so many different regulations going on. But one of the big issues that's been coming up, can an employer mandate an employee to be vaccinated? And what happens if they don't? And what happens if they get COVID? So I'd like to have you elaborate a little bit more on that, and I'll chip in where my experience is relevant.
Well, and I think it's been so interesting because when you think about almost all of our members, because of the ed code requirements, TB test, all prospective employees. And that's something that by law we have always done. A lot of our members also drug test all their new hires, and that would be post-offer pre-employment. Not all do, but I would say the majority, I would say a good over 95% of our members make it mandatory that you pass drug tests before you're hired. So it's been kind of interesting, the questions surrounding the vaccine. And when EEOC said that COVID-19 was considered a direct threat, so employers could mandate the vaccine, then employers really took a step back and thought, well, do we want to make it mandatory, or do we want a voluntary process and provide the vaccine for those who want it? And it's HIPAA protected medical information, and we won't be asking any employees whether they've been vaccinated when they come back to work. And then there's been a lot of questions surrounding if they choose not to be vaccinated, can they file a work comp claim? Is that a bar to a claim? So that's been interesting too. I will say anecdotally, most of our school districts have been, the vaccination had their written policy on vaccinations has been voluntary, of encouraging it. Most have not been providing it on site, some, but not many. Most have been going through the, VIBA county process to get their employees vaccinated. And they have not been requiring that as a, you cannot come back to work if you are not vaccinated. They have not been requiring that.
Well, I think these two areas are going to be continuing to evolve, because, again, things I heard just this morning on the news as far as, again, then do you become a direct threat to other people if you've not been vaccinated? And so again, the ADA says, does returning to work with or without accommodation present a direct threat or risk of harm or injury to the employee or to others? And so that's the other element to take a look at. So I think it's an interesting conundrum as far as, mandated or not. And like you said, TB has been mandated forever.
For years.
Yeah, and people are questioning the efficacy. Why do we still do this? Haven't we developed
an old law, right?
Yeah. And so then, and I've certainly heard discussions, well, why can't we do that with COVID? Because now with the variants and it doesn't look like it's going to go away, immediately or and so what precautions can we take?
And the EEOC also warns or adds that information, and then under Title VII, those religious exemptions exist, and those exemptions for, like you said, people that have allergy problem or an underlying health condition that makes them unable to get the vaccine. So IPMs would have been needed to be held around that issue. What I see now is that some of our schools that are opening up either this week or next week are planned for dates in April. Some employees are raising that direct threat that because vaccinations are not mandatory, they don't feel safe in coming back to work. So I believe there will be a lot of IPMs held around those particular issues as well.
Yeah, I think it's much like the ADA. Each situation has to be explored on a case by case basis, and certainly I'm available to do that, but certainly a lot of people are skilled and available to do that as well. So I'm not just advocating my services, but it's a complicated issue, and I've been on a number in the last 2 or 3 weeks. The complexity seems to simply grow. It's a little bit different today, I think, than what it was even last fall. As employees were questioning their ability to come back to work and what conditions existed. And I know for the most part, all the regulatory agencies and guidances that you and I are exposed to, and you and I certainly have encouraged too being flexible during this academic year, because everything keeps changing, and we've certainly seen that even since the first of the year. So a flexible, resilient mindset is really important, and again, that case by case basis is critically necessary now as we move into this next phase.
And what I have seen in a lot of the IPMs that some of our districts are holding, and because you've been involved in some of these, is they have been providing temporary accommodation when and where they can based on these issues that we've been talking about: fear of direct threat, fear of coming back to work because vaccines are not mandatory, needing to wear an N95 mask, all of these things. A lot of these accommodations I've been seeing, they'll put a timeline on them, or making them for a period of time rather than permanent and for always. So that's been something kind of new, and that speaks to that flexibility, I think.
Yes. Yeah, that's definitely, when people have been allowed to continue working remotely, it's usually this is for this academic year only. And then, next year will have to be reevaluated in light of whatever conditions exist. I believe I did see something recently, and I think you did too, where the EEOC has said, if an employee can continue working but must do so remotely during these ongoing changing conditions, then even if everybody else is back to work, then continued return working from home should be afforded. Since we now know it can be done, it may not necessarily be the most viable kind of thing. But again, it really begs the whole idea of flexible thinking. About how do we approach this, and what seems best for both the employee and the employer, and is it doable for the foreseeable future?
Right.
Yeah. And so, you sort of touched on this a little bit, but I also want to make sure that we're clear on this. Can an employee be mandated to return to work as schools reopen if they decline to get vaccinated? I think you addressed this, but I want to be clear on the answer here.
So we have not seen that. So that would be in your written vaccination policy. So each school is coming up with their own directives on that. For the ones that have always been open or are reopening now, what I have seen is that it's been voluntary. They encourage the vaccination, but certainly you could return to work if you had not been vaccinated, because they don't even know who's been vaccinated or not, because that is private HIPAA protected information, because they're not mandating vaccination. So it depends on what your vaccination policy is on, how you handle that.
Okay. And then this is an interesting thing we had last week come up as far as volunteers.
Yes.
And what are the different categories? So I'll let you go ahead and take this. I'm going to respond to Charlie real quick.
So we've had a lot of questions about volunteers. So as you know, volunteers are not normally covered under workers' compensation, but you can cover your volunteers by board policy or a written policy of your district. I will say most of the schools that are in our JPA do cover their volunteers. When they're on site and when they're performing volunteer. These would be parent volunteers, adult volunteers, and community volunteers that while they come into the school and they're volunteering, they're covered for workers' comp. So this came up because there were a lot of districts that were recommending that their employees go volunteer at the county at vaccination sites, doing all kinds of things because the county needed the help. And so what I just have stressed to them was, if it's on work time and you're allowing them to take work time to go volunteer somewhere else, that could possibly come back and be a work comp claim. That gets into a little gray area. And if they are, obviously, if they're volunteering at your site doing anything with vaccination or with any other thing, and you have a policy that you cover your volunteers for workers' comp and they got COVID while they were on your site, then their COVID would be covered if it was found to be work-related, just like any of your employees. So I guess there's been a little disconnect about COVID and volunteers, because they've been saying, no, that's not work related, but that goes back to your board policy or district policy. If you're covering volunteers, then if you had a volunteer on site and they claimed that they got COVID from either the students or staff while working on site, that could be a work comp exposure.
Okay, great. I know the other question that's come up with that then too is, like, you're working for one department, but then you are released to go work for another department, and then you get COVID and working for that other department, then who's responsible? Or it could be different employers,
Right.
Yeah.
We have had, not many, but we have had some of our large districts enter into a contract with the county to provide their nurses and their healthcare workers to the county on county vaccination sites to vaccinate the general public. And there was a lot of discussion about who do they work for when they're doing that, and who covers them for workers' comp. And that's by that contract written agreement. That would be the same way that we cover ROP students when they go out and perform internship hours at healthcare clinics. That's by agreement with that clinic. Generally speaking, the school district usually agrees to cover their employees when they send them out somewhere at a third-party site, because usually that employer won't accept the liability. And that has been our experience with a lot of these agreements we've been seeing with the County of San Diego, that if you do lend or make an agreement to have your healthcare workers on their work time to go and perform duties for them, that is, the agreement needs to be clear. Who's going to cover them if they get hurt while they're still your employees, but while they're working at somebody else's work site, who covers them? And you go back, it's the same as the agreements that we have in ROP. We also have these agreements with some of our special ed work programs, where we have them in a special ed program, but we have them out in the community working. It's the same thing. There has to be a written agreement in that program, who's going to cover either those students or those employees when they're out performing work duties somewhere else.
Yeah, well, I can think of two situations that are related to that, in that one is, it's just that the condition of employment, employer can redirect an employee's performance of job duties at reasonable locations. And so that's a general provision that exists. And so if you are at another location for another business, for example, you're still the employee of the original agency who has the ability, the right to redirect your work and where you work. So that's one thing. But then it also ties to, I know it's not so applicable in the school district situation, but with temporary agencies, temporary employees that go out to work at different employer sites are technically the employee of the job agency, not the other way around. And so the job agency is who holds the workers' compensation responsibility for that, where that work person goes.
Right.
Yeah.
I did want to add with respect to the COVID, there has been some questions coming up in response to the employer's responsibility to report anyone that tests positive for COVID into the Athens reporting portal. It has come up time and time again. We don't need to report them unless it's a work comp claim, but those things have nothing to do with each other. We have a reporting for work comp claims and we have reporting for COVID claims. So if you know somebody tests positive for COVID, that's one of your employees, it doesn't matter where they got COVID or it doesn't matter if they don't file a work comp claim for COVID, or if they don't allege it's COVID, you have to report it into the COVID-19 portal. And this is because they're collecting all kinds of data, at the state level on who's getting COVID, how many people are getting COVID. And it's also to help us determine what's a community outbreak. That's another reason why those things go into the portal. But they're really a record keeping place, not a claim filing place, the COVID portal. So there's been a lot of confusion about that. And a lot of the districts have come, a lot of the schools have said, now that we're getting ready to reopen, if our policy is that vaccination of our employees is voluntary, meaning you can go get vaccinated, we encourage you to do that, but it's not mandatory, to come back to work. So if that's your policy, a lot of them have said if the employee decides not to get the vaccine and they return to work and they're exposed to COVID and they get COVID, that's a bar, right, to filing a comp claim. I'm like, no, that's not a bar to filing a comp claim. The workers' comp presumptions and COVID laws are completely silent, do not state in any way that whether you get a vaccine or whether you don't get a vaccine means you're going to be covered or not covered for workers' comp. The legal obligations for the third-party administrator or the claims administrator, the claims examiner, to determine if you're exposed at work has nothing to do with the vaccination. The vaccination would be information that they would gather as part of their process, but it does not mean that that person can't file a comp claim because they chose not to be vaccinated, or that their comp claim won't be accepted as being industrial. We would go through the same process that we do to determine if they were exposed at work. And if it was felt that they were exposed at work and we can't prove that they were exposed anywhere else, then we would pick up the work comp claim. So that process is still going to go on, the forensic process of trying to determine where you got exposed, regardless of whether you chose to have the vaccine or not.
Yeah. Well, again, I think that's an interesting scenario, because if we truly are practicing social distancing, if we truly are wearing the mask as presently required, and if vast majority of people are getting vaccinated, then the likelihood of procuring COVID-19, we would hope, would be drastically reduced.
Some of the COVID claims, we haven't had a tremendous amount, knock on wood right now that I just said that, of workers' comp COVID claims that have found to be work-related. But I think the reason for that is we haven't had a lot of people file because we have not been reopened in a large way with everybody. And also because we've been providing benefits, FFCRA, for the people that are quarantining. So a lot of times there wasn't a tremendous amount of disability that they were outstanding. The claims that we have seen that have been picked up, it's been very interesting. They have been usually supervisors or groups, to your point, that have not been social distancing, that had a lunch party that they were not supposed to have in close quarters with their masks off. They relaxed the standards a little bit, and wherever they were, maybe the district didn't even know that had happened, right, until after the exposure. So the ones that we have seen have usually been sometimes in instances like that.
Okay. So it is really important, as they keep saying on the news as well, this is not the time to let down your guard. This is the time to keep up, again, the social distancing, the mask wearing, all the provisions, the sanitization. And now, again, with the vaccine available to the majority of us, that hopefully this will not be a raging issue, but it's not done yet. We're not out of the woods yet, and we've got some ways to go, particularly, as you said, as schools are reopening and as the higher grades start coming back onto the campuses. And, I was just in an interesting situation, and I had to really contemplate it over the weekend, because here I'm, getting my second vaccination. And because of my work with the school districts and the college districts, I'm particularly aware of the college districts not doing any on-site teaching for the remainder of the year.
Very little, right?
Yeah, Southwestern College has been that way since last March. They made that decision way back in June, actually. And so I was actually looking at, doing a teaching project for a college district. And so we've been going along, and I'm getting my TB test tomorrow. And, so,
right.
And so I found out late Thursday afternoon, no, Friday afternoon, that they were expecting me to teach on site. And I was like, what? And it's like that I didn't enter into this whole project with that notion in mind, knowing what I know about the college districts. And that was a slight detail you didn't inform me about a long time ago. And I never thought to ask because everything's been done virtual.
Mm-hmm.
So I've got a decision to make very soon because I'm supposed to start right about the time of my 14 days of full vaccine, full efficacy is in place.
Mm-hmm.
And it's a young cohort, not the kind of young adults that necessarily
Yes.
they're social distancing. And so it's just like, I think it's a little too early for me. And
Mm-hmm.
I don't have any serious underlying condition. I just want to be safe. I just want to do the right thing. And I just
Sure.
think it's premature. So.
Yes. And don't you think a lot of our employees anyway, feel similarly? Not everyone, but a lot,
Yeah.
right? It's a lot to consider.
Yeah. Well, and because I do what I do, I get to hear everyone's perspectives about it. And so, just when it came down to me, it's like, well, I do have a choice and I'm not obligated because I'm actually not officially hired yet. But, it was an interesting conundrum for me over the weekend. So, yeah.
You and I always feel this way, but compassion and empathy are requirements to do a good job now more than they ever were. They always were requirements to do a good job, working with people, managing people, whatever your job is. And now it's an absolute must.
Yes, absolutely. And again, I just have to emphasize taking a case by case approach.
Mm-hmm.
Yep.
Right.
We have a few minutes left here, and I would like to just encourage our participants online to put any questions you have in the chat box, or feel free to unmute yourself and ask Felicia and I any questions that you have. While people think about that, Felicia, I did want to ask, and I don't know if it's appropriate for you to respond, but are there particular areas of the county that seem to be less impacted, therefore opening maybe faster than others, and some areas that are significantly impacted and are slower to open than others?
We have some members in large areas where they have been able to open, and they have been open for a while in a hybrid type schedule, and have been able to not have a tremendous amount of COVID. And then we have some, like one of our school districts just opened in the North County, just opened last week. And on the day of their opening, with masks and distancing and a hybrid schedule, they had 95% attendance on their first day of reopening. That's a higher attendance level for that school than they had pre-COVID on any day. So it does make you think about how much the students are excited about getting back to school. Right.
Yeah, so that speaks a lot to the social isolation that we, have all been feeling, and how anxious people are to have social interaction again. So that is exciting. Hopefully that will continue. Yeah.
I thought that was a really interesting stat and trend. So because some of our larger districts have been open in a hybrid model, maybe a few days a week, and then virtual a few days a week for a while now. But the ones that are just reopening now and into April, it's been real interesting to see the attendance, how high the attendance has been.
That's great. Well, I think, as I shared with you, is that some school districts in another county Office of Education have reached out to me to do more professional development, so that they can bring employees back together, because there hasn't been training, there hasn't been social gatherings. And so we've had really good responses, like 40, 50, 60 employees joining us for an hour-long workshop, and I engage them in fun activities, but about serious topics like how to deal with grief and loss, staying sane in an insane world. How do you deal with people who are, emotionally charged and difficult situations result? But people keep saying it's just so nice to see people, because I get them involved in breakout rooms and conversations, and they really, really enjoyed that. So yeah, we do have a question here from Alejandra. Do you know what type of incentives employers in San Diego are offering to its employees if they get vaccinated? And so anything on your end?
Yeah, that's a great question. I do know of a private employer, just because I know the risk manager that manages their work comp claims, and we were talking, and they're offering $100 gift card as a an incentive for their employees to get vaccinated. They're not requiring vaccinations. Vaccinations are not mandatory, but they were giving a gift card to anyone. So I'm not sure how I think the proof she was saying was that they give you a little card. I'm sure you got one too with the information. And so I'm not sure how they were requiring the documentation to prove that they got the vaccination, but once whatever the proof was, then they provided a gift card. And they still have a voluntary vaccination policy, but they're doing the incentives because what they want to do is they want to try to mitigate that work comp exposure and in people coming back to work and getting the largest amount vaccinated that they can. So I have heard of gift cards, I've heard of but mostly cash and gift cards incentives of $50, $100, right?
Well, likewise, I would have to say that's what I've been seeing and hearing is, read up a lot on what employers are doing at large. And I would also share, again, the school districts are a little different, because direct service starter students, but a lot of employers are looking at an ongoing hybrid model of work because people are oftentimes proving to be just as productive, if not more. Being at home, and they actually are able to reduce some overhead by letting go of office space, and employees so far are reporting being a lot more satisfied. Again, it works in some job areas, not in all job areas,
right?
Yeah, and so they're trying to be creative about incentives to help people move along. I just going back to the vaccination for a moment, I find it interesting because have you had your second one yet?
Not yet. I'm scheduled.
Because at least where I went through the UCSD system at Petco Park. I've already got a card verifying that I got the first vaccination, and I'll take it back this afternoon to get verification. And for travel and stuff like that, they're talking about making that mandatory. If you want to get on a plane, you got to show you're vaccinated. And so it's just the same as if you're being tested negative for COVID. And so it's interesting where the mindset and the what employers feel or industries feel they can and cannot do, because it's definitely, I'm going to be carrying my card around for a long time, proving I've been vaccinated. So
right, carry it in your wallet, right? I have it in my wallet. But you're right, I have seen that they're thinking about for travel and even in the future, perhaps attending large venues, that you will show your vaccination like you show your driver's license or you show your ticket. You show your ticket and your vaccination record, and you get on the plane and show your driver's license or your passport and show your vaccination. So it's interesting, that little piece of information might be something that we're required to carry around in the future.
Yeah. So more things to evolve and more things to develop, and it is certainly a dynamic world out there. And I would say, I think in the last month to 45 days, everybody's been more optimistic, and load is a little lighter on our shoulders. Doesn't mean there's still a lot going on, but I think some of the fear factor has been reduced considerably. And we're going to continue doing these monthly Q&A calls. So look for the next one around mid-April. I know I've got the date, I'm not remembering off the top of my head, but we'll make sure we put that into the show notes in terms of the recording that's available for people, and as well as when our next date is, so that you can register ahead of time for that. And so any last words, Felicia, wishing our participants here?
Yes, it's such a pleasure. It's been so wonderful to be with you and talk about these issues. It's been very challenging last year, but I do feel that uplift that you feel too. A lot of positive things and energy that I see now. So
yeah. I think for a long time, many of us are feeling a little stuck, doing our day-to-day work, but feeling stuck and not being able to do as much. And I know it was pretty heartwarming to see over the weekend some of the clips on the news as far as grandparents and grandchildren being reunited for the first time in years. So to me, that's hope. That's, like you say, optimism, and it's going to be a new and different world out there. And I just encourage everyone not to think that we're going to go back to the same, because I just don't think it will be.
Right.
Yeah. Okay. Well, thank you so much, everyone, for being here. Thank you, Felicia. And just so our listeners and viewers know that we get together before this this Q&A session. So we're talking about what's hot in this last month and what do people want to hear about. So if you have something that you want to know more about, please reach out to either Felicia or myself via email and let us know the topics that you want to explore and what questions you have about where things are going. And I'm sure we'll probably see maybe more about this whole idea about incentives, because that's sort of a new area. And as we get into all kinds of questions about vaccines and safe return to work and all those kinds of good things.
Yeah. Well, it's my pleasure to be with you, Deborah, as always.
Well, thank you. And thank you to everyone who participated today, and we'll be in touch. Look for us in about 2 to 4 days as far as getting the link back out to you. And thank you for your kind words in the chat box. Have a great Monday and have a great week ahead. Dr. Deborah Dupree, the Mindset Doc.